Okay, so let's finish up our integumentary system with part 3. So there are 3 types of lice then that can affect the body. So this would be Pediculus humanus corporus, which is body lice, right? Thripus pubis, which would be pubic lice, and Pediculus humanus capitis, which is head lice. So capitis, head, corpus, think body, but you can see how the words are the same, just where they're located can change the name. There's 3 major types of skin cancer that we need to worry about too. So there would be malignant melanoma. This would be rapidly progressing, a malignant tumor of our melanocytes. Remember, melanocytes are in the skin. They're what gives us our skin pigment, right? And then it's rapidly progressing because it's a melanoma. Right? Basal cell carcinoma is a neoplasm of the non-keratinizing skin cells that we have in the basal layer of our epidermis. So think back to A&P and the different layers of the skin, or the epidermis. This is in the basal layer. And it's the most common type of skin cancer in white skin-toned people. Squamous cell carcinomas are the second most frequently occurring type of malignant tumors, and they affect the outer layer of the dermis. And here, remember how we talked about making sure you use sunscreen even on your ears and on your head. We can see here a lesion on the tip of the ears. Alright, so how do you identify melanomas? The things we want to look for, think A, B, C, D. First you're going to see is it symmetrical. So the first column would be normal skin lesion or skin eruptions, and then the second column is melanoma examples. So for melanoma or any type of skin disorder, we would be concerned if the shape of it is not symmetrical. If half of the mole, for example, does not match the other half, then we would be concerned about a melanoma. If it does not have a clear border around it, for example, you can see here how you have a nice circumscribed edge to the normal type of mole. But in a lesion that can be malignant, the borders are not clear. They often fade out into the surrounding tissue. The color is often not uniform either. You can see in this example where this half is darker than this half. That often happens because of the skin changes in the spreading or the tumor size. And then the diameter. If the lesion is bigger than the tip of a pencil eraser, we should be concerned and possibly get it checked out. Because most moles, freckles, things like that do not get that big. So we would want to get them checked out if they're bigger than the tip of an eraser. Alright, so malignant melanoma is a serious form of skin cancer. The incidence of the disease is increasing. If we think back, I mean, not as many people are doing like tanning beds and things, but the generation that was real hot in the 80s and 90s, early 2000s, those folks are increasing our incidence of skin cancer. About 1 in 100 people in the United States can expect to develop melanoma in their lifetime. Without treatment, it has the tendency to spread very quickly and to be metastatic. So think back, metastatic means that it's going to affect various areas of the body and different organ systems. The problem is that it's often easy to ignore a skin lesion, or you can have it in a place you don't see, like your back, on your butt, in your hair, okay, that you don't check regularly. There are 4 clinical types of melanoma. There's superficial spreading, nodular, aquilitiginous, and lentigo maligna. Let's look at these. So superficial spreading. This is generally the most common type. It's about 65% of them. And it means that it's going to spread across the surface layers. Here, be flat across the surface area of the skin. It begins at one focus area on the skin, and then it's going to go across the dermal-epidermal junction, meaning superficially, okay, across those junctions of the skin cells. It usually grows in a horizontal plane along and just above that junction area. Right. This is often referred to as radial growth because you will see it will grow in one spot and then radially spread out from there. Right. Nodular melanoma is less common, all right, but in this type, there's no horizontal phase, which means it doesn't go up, or doesn't go across, like the other one. It tends to be more bumped or raised. The growth of the lesion can correlate to the prognosis of the patient. The deeper or larger the lump is, or the nodule, the worse the prognosis is. All right, so nodular melanoma is often less amendable, meaning that it's not as easy to treat, all right, than superficial spreading is, because it often metastasizes faster. Lentigo maligna melanoma is often among the elderly population. You even hear these sometimes called age spots or sunspots. This lesion may grow for years as an in situ, meaning a capsulated tumor, before it ever develops into a more aggressive phase. So what we often do is we watch these. Where you see these, and you probably know people that have these all over their body, and their doctors and their healthcare providers should be watching them. And as long as they stay flat and contained, then we don't worry about them. If they move into a nodular growth or a more aggressive growth phase, then we would be concerned, and they would try and remove them and biopsy them. Acrolitiginous melanoma often occurs on the hands and feet. Right? It has a reputation for being ignored. It often isn't painful, it's just ugly, so people tend to not want to deal with it. They might think it's from stubbing their toe, or especially if they're diabetic or having a problem with that. Right? But the issue is that it spreads very quickly to metastatic disease. So if we see it, we need to be sure that we're moving fast to try and treat it. All right, the other problem that can happen to our skin is burns. All right, we classify burns as first, second, and third degree. Once you get into second, you can have partial or full thickness. We rate the burn by degree depending on how deep it affects the epidermal layers. So the first degree only affects the outer top. This often just looks like a red spot on the skin. All right, so sunburn is actually a type of first degree burn to the skin. Second degree, partial thickness, is where you involve the epidermal layers and maybe some other layers of the dermis. You will see blistering if you have a second degree burn. A second degree full thickness burn is where we're going through all the dermal layers. All right, so it's going deeper down in. And in a third degree full thickness burn, you are through the dermis and into the subcutaneous tissue, and it can even go through muscle and bone. All right, so skin of babies. Babies often have different integumentary system changes. Some are a problem, some are not. All right, so vascular or pigmented birthmarks. We talked about the Mongolian spot earlier. They can also have hemangiomas, and you may even hear this called a strawberry birthmark. These are like a mole made of blood vessels. So they're benign. We have to watch them. Sometimes they will even grow in size. They can be anywhere on the body. This one's on their back. They can also have them on their face, their hand, things like that. But they're not going to cause cancer or anything. They're not a sign that there's a pathology. Patients and newborns are often prone to diaper rash. Prickly heat rash, it happens whenever their sebaceous glands and their hair follicles get clogged, especially if they're exposed to heat, so in summertime, things like that. And then cradle cap is a dermatology problem where their sebaceous glands on their head get clogged, and they'll get like a flaky, dry rash on their scalp. It will often cause their hair to fall out. Once it clears up, the hair does grow back. It doesn't cause scarring or anything. Infectious diseases are also very common in our pediatric population, and they most often cause rashes as well. So, roseola is a rash that is often accompanied by a very high fever for 3 days, and then the rash comes. All right, the fever goes away and the rash comes out. Rubella would be measles. Chickenpox is another one. All right. Rubeola is measles. Rubella is another type. and scarlet fever. So most often we have some vaccinations, like for chickenpox now, and measles, and rubella, MMR. But as we have discussed in the past with people who choose not to vaccinate their children, we are still seeing more outbreaks of these, like the outbreak of measles at Disneyland, or mumps among the penguins this last season. And we would have to consider that whenever we're assessing children and we see rashes, we need to ask about the vaccination history. These are also communicable, which means that they spread very easily among pediatric populations as well too. Alright, so skin disorders in the elderly population. As we get older, our skin changes, the pigmentation changes, and our sweat glands change, and it just causes different skin problems among the elderly. They are not usually cancerous. We just need to keep an eye on them. Skin tags are where you get extra little pieces of skin that hang off like a tag on a piece of clothing. Keratosis is where they get like this crusty, hyperpigmented areas of the skin. You almost feel like you should be able to scrape it off, but it will just come back. And litigogenes is these areas here, these flat, small, darkened areas of the skin in folds. Okay, so email me if you have any questions or concerns about the skin. This is the last part of the integumentary system. And if you have any questions regarding the study guide that you need to do, it will help you study for the final. You can email me as well. Thanks, guys.